Namaste and good morning, friends. I am very happy to welcome you all in the second episode of our mental health talk show, Inside Out, where we are having conversations on mental health. As a part of our mental health awareness program, we are reaching out to institutions, organizations, individuals to make an impact, to make voice heard, and to make sure we speak about mental well being in general. In the first episode of this mental health talk show, Inside Out, we met a prominent psychologist where we discussed the general mental well being, what exactly it means to us, how to identify, how to approach to this mental well being. In this, we are now in the second week of Mental Health Awareness Program 2023, and I'm very happy to host a very special guest today. And it's not a coincidence, but it's a thing that has happened, that we have a very special guest, Dr. Vaishali Jathar, who's a
Yes,
and today being a Doctor Day, National Doctor Day. So Vaishali ji, first of all, congratulations and happy Doctor's Day.
thank you. Thank you.
And we have another very special guest, that's Dr. Bhakti Lagad, and she is a naturopathy expert and yoga professional. Dr. Bhakti, welcome. First, we'll introduce our guest. Dr. Vaishali ji has been BAMS and counseling psychologist. She has done her certifications in nutrition and health, and she has been working as a health psychologist professional with an experience of more than 20 years. She has been associated with Symbiosis International University as a medical officer. Vaishali ji, welcome to this platform, and I'm very eager to listen to you.
Thank you. Thank you,
Uh,
Kamlesh.
Coming to Dr. Bhakti ji, I know it's a very great thing to have you here on our show, and she has been into these naturopathy and yoga for last 20 years. So we have two prominent guests who have been working in the field of yoga, Ayurveda, and mental health since last 2 decades. I'll be very happy and welcoming you both on this show. Shall we begin?
Yes, sure.
Yes, fantastic. I think today's topic is mental well-being and integrated approach in Ayurveda and yoga. The theme of our mental health awareness program 2023 is unifying Indian wisdom and knowledge with the Western evidence-based approaches. So today we are here to discuss Indian wisdom and knowledge about yoga and Ayurveda and its impact on mental well-being. So, Vaishali ji, will start with you first.
Yes.
First of all, I would like to understand what's the definition of health according to the modern science.
Yes, yes. Sure. We will see both the definitions by modern science and by Ayurveda as well
Okay,
and
okay.
compare both the definitions. According to World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of the disease or infirmity. Means what World Health Organization says: a complete health means physical health, mental health, and social health. Not absence of the disease, that the person is not any ill health is not a healthy. He should enjoy all these three dimensions of health. So, the health is physical, mental, and social health by the modern science according to World Health Organization. Now we
Yes.
will see the definition of health, swastha by Ayurveda. According to Ayurveda, the definition of swastha is samadosha, samagni, samadhatu, samamalakriya, prasanna atma indriyamana swastha iti abhidhyate. Means Ayurveda has focused samadosha, tridosha, samagni, good agni, dhatu mala, all these functions of body should be normal and balanced. not only this body functions, but our Atma Mana Indriya should be well maintained, balanced, and in equilibrium. Then the person is said a swastha person. So decades ago, thousands of years ago, Ayurveda has the same concept of healthy mind, healthy physical health, and healthy social health. So our science, our Indian science, thousands of years ago, the same concept which we are still following using. What is health?
Okay, okay. Thank you so much, ma'am. Bhakti ji, coming to you, you being a naturopath expert and yoga expert, how do you see health? How do you define health? Yes.
For me, according to the word health, it actually comes from the word whole. It's like that. That means feeling healthy means to be complete. That
Mm-hmm.
is a sense of wholeness within ourselves, which I feel it. For this, can happen that body should be vibrant. Our physical energy must be vibrant. Our physical energies must be vibrant. Our mind should be joyful. What actually I feel that health is that is wholeness, that is completely one. It should be within. That is the only thing.
Yes, yes, yes. Thank you, thank you. There has always been a question in my mind as a student of psychology. I think this is the right place to ask the question. We have always addressed Ayurveda and yoga as an alternative medicine, and we are talking about allopathy as a regular medicine. So, isn't should it be vice versa? Like Ayurveda could be a real medicine, yoga could be a real medicine, and allopathy as an alternate medicine. Vaishali ji, can you put some light on this?
Ye- Yes, yes. Uh, we are generally saying that preventive health is better than cure. It's a very common and frequently used phrase. Preventive is much more better. And as we can see, at least one member in each family is suffering from non communicable diseases. So, blood pressure, diabetes, obesity, these are the rising issues, health issues. And modern medicine is using drugs and little bit some another diet and these advices. But Ayurveda has an holistic approach. It not only focuses on body but mind and soul. So all these lifestyle related diseases has a good answer in Ayurveda, our ancient science, because it focused on good diet, balanced diet, exercise, sleep. All these things are which are related to our day-to-day living, our life cycle, is all considered and focused in Ayurveda. So to prevent any disease, and if it happens, so I can share provision of Ayurveda, so it will
Yes, yes,
to
yes.
better understand. Yeah,
Okay.
as per the Ayurveda, the purpose of the provision of the health is swasthasya swasthya rakshanam aturasya vikar prashanam. We'll see the meaning of this shloka. The person who is swastha, who is healthy, we have to maintain his health, and the person who is diseased or having some illness, we have to cure him, treat him. So, as I said, ki thousands of years ago, Ayurveda has that provision ki prevention is always better than cure. So,
Yes.
in the regular, in the routine life, we have to follow Ayurveda because
Hmm.
there is a Dinacharya, Rutucharya. All these things are written very well in our ancient science, our
Okay.
Indian
Yes.
science. So,
Yes.
being
Yes.
an Indian, we have to be first focus should be our culture, our Indian science, our Ayurveda.
Definitely. Yes.
Modern
Yes.
science is I'm also using modern science. It is very useful, but being a Indian and our culture, our routine should be focused on our science, Ayurveda.
I think it is very rightly said by our saints and all that, whatever good in our culture, we should definitely take it, and whatever is good in other culture, that we should also take
Yes,
it. And
yes,
therefore, Ayurveda, in collaboration with the Western medicine, will definitely have a bigger impact and positive impact.
yes,
Bhakti ji, coming to you, whenever since my childhood, like, yoga, when we talk about yoga, it's always been stretching, putting yourself in a very difficult situation. आपण असं खूप तुम्हाला अंगाला त्रास देणे असं काहीतरी पूर्वी ते सांगितलं जायचं तर योगा. बट देन आय नो द थिंग्स आर चेंजिंग स्लोली. सो एक्झॅक्ट कॅन यू जस्ट टेल अस लिटल बिट मोर अबाउट योगा ॲज अ सायन्स अँड हाऊ टू सी टू इट?
Yes, yes, sure. Normally, basically, when we see that, as whatever you said it, Mr. Kamlesh, that is right. People feel that stretching is where raising the leg up and keeping it around your neck and then splitting the legs and just breathing in from one nostril and breathing out. Then that is the yoga. And just sitting in one perfect any position, that is called yoga. That is actually not yoga. Yoga, which you do it in a day-to-day life. तुम्ही तुमच्या दिवसाच्या संपूर्ण दिनचर्यामध्ये पण ती गोष्ट करता. इट्स लाईक दॅट. दॅट इज अ योग वेअर your mind, your body, your soul, everything comes together. That is actually yoga. For example, you're watching a television. Okay, you're watching a television and you're completely engrossed in that, where your mind, your body, soul, everything is over there, and you completely तुम्ही त्या कॅरेक्टर मध्ये इतके घुसून जाता की that you feel that आगे का person is crying and immediately we have seen that most of them also cries. It's like that. That is actually a yoga. So हे डेली लाईफ मध्ये होत असतं आपल्याबरोबर. अँड नाव कमिंग टू द इट्स व्हॉट एक्झॅक्टली व्हॉट आय टीच इट, व्हॉट आय प्रीच इट टू माय स्टुडंट्स, टू द कॉर्पोरेट सेक्टर्स or to the police force, whoever like that, की it depends upon to person बॉडीच्या टाईपवर डिपेंडेंट. ऍज डॉक्टर वैशाली शी इज अन आयुर्वेदा डॉक्टर. सो इट्स लाईक दॅट. बॉडीची आपली बॉडी 3 प्रकृतीने बनली आहे, वात, पित्त आणि कफ. Is completely. So even the yogic practices is completely depend on that. What type of prakriti you have, what type of what is your age, it depends upon that. त्या प्रकारे ते केलं पाहिजे. Asanas and yoga, it doesn't mean you have to stretch yourself to that particular stage. It is not like that. You have to do it till you feel it comfortable. Yoga is not a competition. It is just within, you have to compete with your own self, with your own ability. That is the word is yoga. Yoga doesn't mean that, array, now if you go and scroll on social media, you will see lots of stretching. एक पैर ऊपर उठा रहे हैं, कुछ ऐसे split करे. Wow, it's you get 1,000 likes and 100 likes and like that. No,
Yes,
that's not
yes,
yoga.
yes.
It's a very in the wrong way they are just propaganding it. It is wrong way. It is not like that. Normal
Yes,
to me
yes.
basic just focus on reading this. That is actually yoga.
Fantastic. Thank you so much for this, enlightening answer. I remember the Karate Kid. There's a movie named Karate Kid. त्यामध्ये Jackie Chan is a leading actor. So he's teaching one of his student and Jackie Chan तो रोजचं त्याचं जे घराचं काम करतोय. The student asks him, when do you get time to do kung fu? So he's like, everything I do is a kung fu. So I think everything we do in 24/7, that's yoga, I think, rightly said. So yeah, Bhaktiji. Coming to the another aspect, and I think that's why we are here talking about mental health. How does Ayurveda, Yoga, Naturopathy looks at mental health? Vaishali ji.
Yes, yes. Ayurveda believes that physical health and mental health go hand in hand. If a person is physically ill, his mental health also affected and vice versa. If a person has mentally sick or has some issues, his physical capabilities, abilities also restricted. So long back, Ayurveda has a deep knowledge of mental health and has focused on our mental health as well. So,
Mhm.
as Ayurveda has believed that every person, every individual has different and has made up of 3 doshas, dhatus and malas. So, balance of all these doshas, vata, pitta, kapha, they should be in equilibrium. If there
Mhm.
is in any imbalance in these doshas or some agantus dosh is there, the person gets sick, and it may be a mental ill health. Even we have mind is like a monkey, it just roam here and there, so we have to be keep in control. Okay, so here the Ayurveda and yoga are useful, and in Ayurveda there are very much approaches, different approaches to treat mental health. Even mind has Sattva, Raja, Tama. These are
Okay.
three aspects of mind. Where Sattva
Mm-hmm.
is pure soul, pure state. It keeps us healthy. It never hurts our health. But Raja has the activity and Tama has inertia. If Raja and Tama gets affected, it affects our physical and mental health also. Even
Yeah.
Ayurveda believes in negative emotions and which emotions affect our health. Kama, Krodha, Lobha, Moha, Matsar, Ahankar. All these are negative emotions, and these
Mm.
negative emotions affect our daily routine, our physical activities, and eventually our mental health. So, Ayurveda believes that all these emotions should be in control in a balanced way, and more of the positive emotions, our routine, our dinacharya should be in a positive way to keep
Okay.
our mental health in balance. So there are very much approaches to keep our mental health in a good way, in a balanced state.
Okay. Okay. Vaishali ji, are there any clients or patients you have seen who have actually come with the cases of stress or anxiety to you, or any case study that you would like to discuss here? Like, how
Yes,
are you
yes,
treating with the help of Ayurveda? Yeah.
yes. Recently, we all go through pandemic, COVID
Yes.
19. Yes, and it's a good uh, disease in a way to understand health because COVID not only affect our physical health, mental health, but it also affect our social health.
Mm.
So we can better go with the COVID 19. The COVID 19, everyone, the word is famous immunity, immunity, kuch bhi karo, immunity badao. So now in during this pandemic, we all everyone at least each and every person focused on good diet, exercise. We have time. We were at home, except doctors and
Yeah.
emergency services.
Yes.
Everyone
Yes.
has having in home, and they all focused on good diet, balanced diet, exercise, yoga and meditation because yoga means huge connection. It connects body and mind. So to
Yes.
have a good immunity, good health, our
Hmm.
diet, our exercise, and this yoga, meditation. Yoga and meditation are soul of our Ayurveda. It controls our mind, relax body and mind. So during COVID-19, there are so much mild cases, even moderate cases are there. Even my
Hmm.
family members are also got COVID-19.
Hmm.
My mother-in-law was admitted in hospital for 28 days. For 28 days, she was in ICU. But
Okay.
she is
My
such
God.
a strong lady that we have to be strong mind, positive approach. Our breathing exercise because when
Hmm.
we breathe we have breathing exercise which Bhakti ma'am will be share uh, relaxation technique and breathing exercise. It keeps calm our body and mind, and it relaxes our overall emotions and create positivity and boost our immunity which helps to
Hmm.
fight any infection. It
Hmm.
gives a positivity faith that we can fight with any disease, and it
Hmm.
helps to faster recovery also. We many time heard in कोविड 19 अरे वो डर के मर गया, उसको कोविड हो गया, डर गया, अचानक से गया, अच्छा तो था, क्या हुआ.
Hmm.
So here medicines are working their work, they are helpful, but along with medicine, diet, exercise, good relaxation techniques, and sound sleep,
Yes.
all these factors are essential. And during COVID or any illness, I always suggest in Ayurveda there is also Pathya Pathya. Pathya
Correct.
Pathya is not only related to food, that what we can do, our activity also are
Hmm.
matters in our good health and for faster recovery. So
Yes.
whenever there is any patient like blood pressure, even
Hmm.
hypertension के patient आते हैं, though we give prescribed medicine, but we
Hmm.
ask them that is there any stress? Just look at it, change your routine, your dinacharya, avoid such foods, have this of more food, start your breathing exercise, relax, do yoga, meditation, and at least good. Not only just sleep should not be counting just hour, but it should be sound. calm. It give times to our body and mind to refresh.
Correct,
So
correct.
sleep is also a good factor in our health. So
Hmm.
this is my experience.
Fantastic. So coming to Bhakti ji, uh, what has been your experience with mental health? Has there been any case studies related to trauma? And can you share with us?
Yes, sure. That's my pleasure. Uh, in these last 22 years, I have many of the patients with me that they, of course, as Dr. Ma'am, she said it, ki yes, during the COVID, there were lots of stress and this thing, and many of them, even in my family member, my mother-in-law, my father-in-law, including my husband, um, my sister, everyone was facing with the same problems with COVID and all these things. Even
Mhm.
I was in a great loss where I lost near about my complete new studio where I opened it and just 2 months back and it was near about 10 lakhs of loss. So I was
My God.
completely drenched out. My husband is a chef and over here there he also his hotel got closed and he was in the lots of psychological problems and everything and it was a completely lost. And from this, of course, for all these things, your willpower should be very much strong for all these things. If your willpower is strong, you can easily get go from all these things. And that was the first thing. And secondly, I will tell you about my thing is like that. Basically, as I'm a medical yoga therapist and a naturopath, it's not related. It's of course related with the mental health, and it was also related because mental health is somewhere related to your physical health. If
Mm-hmm.
your physical health is not fine, is not good, it is going to affect your mental health. It is related. Like
Definitely.
yoga is where mind, your
Yes.
body, and soul, every should be together. Same thing for
Mm-hmm.
mental well-being, strong होने के लिए your physical health should be also strong, which I believe it. It's like that.
Mm-hmm.
So just a few years back, you can say almost. I mean, it's been 22 years, think almost 12 years, 10 years back, almost like that. I met with a major accident. I was not accident. I was dancing, and where got, I was not wearing the proper shoes. Of course, my tutor didn't tell me to wear the proper shoes, and where I slipped my leg and my ligament was torn. My ACL and TCL was torn very badly, and it was completely where doctor said me suggest me go for a bed rest where you cannot do anything and you need to go for the operation. But my profession is where uh, I cannot go for the operation. If I go for operation, I have to rest for 6 months, 6 months, a
My
year
God.
down the line, where
Yeah,
again,
yeah.
again, it is like that. So when I said yes, Bhakti, you can do it. It's okay, fine. It's just broken. You can go for that. Just take a proper diet and this thing. And of course, I didn't force my leg to because as a ligament tear where you cannot stretch yourself, you cannot do anything. And that was a condition where I was my lower side of your my body was completely. You can say their sensations were lost because I was on a bed rest completely. So that was a very major, crucial moment for me where I thought, okay, that everything is lost. I cannot do anything. But my willpower was so strong that I said, okay, no, you can do that thing. I did the proper exercises, the breathing one, and actually pranayam plays a very vital role in this thing. So when you're stressed out, when you're completely, you can say कि ऐसे लगता है कि आगे कुछ नहीं हो सकता है, nothing can happen. So you must have heard it. Any of your relative or your friends say it's okay, relax, you'll be fine. Just catch your breath, take a deep breath, catch your breath, just hold for a while, and you'll be fine. So this actually work and it gives a very effective, it's a very effective advice because when you inhale deeply, it goes in your diaphragm. When you
Mm-hmm.
exhale, it completely it's you are relaxed smoothly. It's like that because the reason when you're inhaling, you're tapping your parasympathetic, sympathetic, and sympathetic nervous system. It's like that.
Okay.
So when you
Yes.
inhale, you inhale, deeply breathe in, hold your breath just for a while, as much as you can, and just exhale. Just see any of the calm or quiet place. Just just do this thing and you can immediately see the results. It plays because it not only works over your respiratory system, but also it has to calm down your mind. And this is how with the breathing techniques, some of the pranayams and few of the of course your diet also plays a major role in this thing, where I follow the lots of things like aloe vera and the proper diet, as I'm a medical yoga therapist. So I do follow everything. My day starts in the morning by 4 o'clock. So
Mhm.
I before the sunrise is like that it starts. So I followed everything like the wheatgrass juice, aloe vera juice, and the proper time pe khana and everything. And this thing actually helped me out. So within 5 6 months, I got covered and I was able to stand on my feet. Of course, using the clutches,
Fantastic.
but
Yes,
I
yes.
did that thing in 3 4 months like that. And now today, after all these years, I'm standing on my legs without any operation. I'm doing everything,
Great.
सब कुछ करती हूँ, but it's like that. Your willpower should be very much strong for all this, and I really came from all these things. So that is
Fantastic.
my experience.
Yes,
That's my
yes,
personal
yes.
experience.
Absolutely, absolutely. And probably that's why we are here with you and talking about it, you know. And I'm very happy that you shared your experience, and that will definitely help anyone and everyone who's going through that phase, or if you're seeing someone going through that phase, so we can definitely, help them with this certain techniques. There's one thing. Now you spoke about pranayam and its importance. We have that kind of a mindset, or I would say there is still a set of people who think anything and everything prescribed by Harvard research, MIT research, Cambridge research. Now they are talking about pranayam in a very different language. They are defining yoga nidra as a guided meditation. Okay, so unfortunately, unless and until it is not approved by Western science or Western academia, so we are, I think, not in a position to accept that. And I think you both are really working hard to clear that mindset. And definitely we need that is evidence based, that is with a clear cut factual data. But I understand there are personal experiences which cannot be put in a number, so we also see that. Coming to you, Vaishali ji, Bhakti ji has rightly spoke about food, proper sleep, nutrition. You're a health psychologist. Can you share certain superfoods, so-called superfoods, that are good for our mental health, and in general physical health, overall complete health?
Yes, sure. Ayurveda has six different Madhur, Amla, Lavan, Kashai, all these tests. And Ayurveda never suggests ki avoid this test, this. Everything should be in equilibrium. दो
Mhm.
शुगर अच्छा है, मीठा है, उसको बहुत खाओ, करेला कड़वा है, उसको नहीं खाना है, ऐसा नहीं है. ओके, सो आयुर्वेदा एडवाइस फूड अकॉर्डिंग टू आवर डिनर कि सुबह क्या खाना है जब एनर्जी बहुत अच्छी है, रात को खाना कैसा होना चाहिए. एंड आवर फूड, आवर अन्न इज एडवाइस्ड एज पर आवर ऋतु कि what
Mm.
food should we have in a rainy season, which food we have to in winter, which food we have to have in summer. And as all our food and choices of food also related to our festivals, we
Mm.
usually see in Sankranti there is winter, so we have more on good and til, which
Feel.
are
Mm.
warm. बाजरे की रोटी अब तब खाते हैं,
हाँ.
right? So all this food defined in Ayurveda, and Ayurveda believes that we become what we have. So
Okay.
sattvic ahar is mostly advisable in Ayurveda. Not too much tikha, too much spicy, or non-veg food. सो इट्स नॉट कि कोई भी नॉन-वेज फूड या ऐसा नहीं खाना है, बट एवरीथिंग शुड बी इन लिमिट. मोस्ट ऑफ द फूड शुड बी सात्विक. जो पुराना होता है, पुराना चावल, पुराना गेहूँ, मूंग है, विच इज़ ईज़ी टू डाइजेस्ट.
Mhm.
एंड देयर इज़ एक where is another concept that Agni, Jathar Agni. So our digestion power. Sometimes our digestion power is weak. So at that time, the heavy food we should not be have. और
Mm-hmm.
कितना खाना है, कैसे खाना है, is all things. Mindful eating is a good concept which
Okay.
are described in Ayurveda as well. We now using such little bit fantastic words and thought this is modern science. Let's follow it. I am having mindful eating. I will not watch TV. But even Ayurveda also, long back, we have that even gratitude therapy. Even in childhood, we have that trend ki vadani kavale gheta naam kya pukarche. We have that gratitude therapy. So it's
Mm-hmm.
not only what we have in food, how to eat it, water intake, वो कैसे होना चाहिए, कितना होना चाहिए. इवन एज के अनुसार भी कि बचपन में क्या खाना चाहिए, जब हम ज़्यादा एक्टिव होते हैं इन आवर यंग एज, उसमें फूड कैसे होना चाहिए, वृद्ध को कैसे होना चाहिए, प्रेग्नेंट लेडी का फूड कैसे होना चाहिए, बीमार का फूड कैसे होना चाहिए, इवन एज पर डिसीजेस ऑल्सो कि
Mm-hmm.
उसमें पथ्य अपथ्य ये बताए. इवन हर्बल मेडिसिन विच वी गिव एनी टैबलेट और काढ़ा और चूर्ण, विद दैट वी विल गिव समथिंग कि ये चूर्ण आप मध से ले लो, ये चूर्ण आप घी के साथ ले लो. दिस इज अनुपान. So it just increases the immunity and digestion power of the medicine. So there is not such a single superfood कि ये खाओ तो immunity बढ़ जाएगी. Yes, there are medicine like
Mm-hmm.
rasayan chikitsa is there to just
Mm-hmm.
increase our immunity, increase our longevity. There are drugs, mostly the well famous recent drug guduchi gandavati. In
Yes.
COVID we uh, almost everyone might have it. Yes,
Mm-hmm.
guduchi is there, amla is there. घी को भी बहुत अच्छा आयुर्वेदा में बताया है कि नॉट ओनली स्नेहन काम करता है अप टू आवर फिजिक्स बट इट्स गुड
Mm-hmm.
फॉर आवर मेंटल हेल्थ ऑल्सो. And
Okay.
Ayurveda believes that food not only nourishes our body but our mind and soul also. So जब
Mm-hmm.
हम खाते हैं दूसरों को भी इक्वली उसका शेयर देते हैं. So it also boost our good health. So सिंगल ऐसा कोई सुपर फूड नहीं है. व्यक्ति परत
Yes.
पे
Yes.
वात वात प्रकृति है तो उसको
Mm-hmm.
क्या खाना चाहिए, कफ के लिए
Mm-hmm.
क्या खाना चाहिए,
Yes.
अगर
Yes.
कृष है तो उसको कौन सा. इवन
हाँ.
हर एक का उसमें से बताया है कि
Mm-hmm.
कैसे क्या खाना चाहिए, कितनी मात्रा में खाना चाहिए, किसके साथ क्या खाना चाहिए. सो इट्स अ
Yes.
डीपर स्टडी.
Yes.
यस.
Thank you so much. Uh, I'm sure now I'll make sure that I am eating mindfulness. Eating will start to do like every one of us will be doing that. Bhakti ji,
Yes,
coming to
and
you. Yes,
yes,
please, ma'am.
yes, Ayurveda respect also nature because
Uh,
human being is connected with nature. So we have to be grateful to our nature. So we
mhm.
get food from nature. So दूध है, दही है, वो एनिमल से आते हैं. तो we should be always thankful and grateful to our nature also. It brings a
Yes.
good positive energy to us, and it's easy to digestion to our food.
आई
So
थिंक वन वर्ड डिस्क्राइब किया जाए तो आप जो बोल रहे हो वो ग्रेटिट्यूड के साथ कीजिए जो कुछ
yes,
आप करोगे. आई थिंक दैट
yes.
दैट प्लेज अ व्हेरी इम्पॉर्टंट रोल. कृतज्ञ आपण त्याला म्हणूयात. आय थिंक
Yes.
जे
Hmm.
आपण घेतोय, अन्न प्राशन करतो आहे. सो येस, भक्ती जी, कमिंग टू यू. वी नाउ वी आर टॉकिंग अबाउट योगा and its excellent healing qualities. But again, there is always a confusion for a common man, a common person, I would say. Patanjali योग, हठ योग, असे काही प्रकार आहेत. Can you shed some light on that, and how one should approach to yoga and what that person should be doing initially?
सी तसं पाहायला गेलं तर खूप सारे योग आहेत.
हो,
विन्यासा
हो.
योग, पतंजली
हं,
योग, हठ योग,
हं,
अष्टांग योग, इट्स लाइक दैट.
हं, हं, हं.
Following one particular yog will not be the solution. It's like that. की
हं, हं.
बरेच जण क्लासमध्ये येतात, मॅम आय वॉन्ट टू लर्न द पॉवर योगा. आजकाल
हां.
पॉवर योगा हे खूप फॅडमध्ये आहे. पॉवर
हो.
योगा शिकायचं. फर्स्ट ऑफ ऑल कार योगा सारखं योगा हे नाहीच आहे.
Hmm.
दिस दॅट इज नॉट द कन्सेप्ट. हा योगाच नाहीये. लोकांनी त्याला आणलंय फक्त वरती. दॅट इज द
Yes.
ओनली थिंग. असं
Hmm.
कन्सेप्टच नाहीये. इट्स ओनली दॅट हठ हठ योगा द ह
Oh.
stands for sun, th stands for moon. Right is followed by the left side. Forward bending is followed by the backward bending.
Hmm.
सूर्यनमस्कारमध्ये पण हात आधी इथेच असतात. 2 ला श्वास घेत आपण वरच जातो. बॅकवर्ड
Hmm.
बेंडिंग इज फॉलोड बाय द फॉरवर्ड बेंडिंग. प्रत्येक ह्याच्यामध्ये दॅट इज कॉल्ड ॲज योगा. म्हणजे जसं मी आधी पण सांगितलं, योगा म्हणजे स्ट्रेचिंग हे नाहीये. तुम्हाला तुमच्या कम्फर्टनुसार करायचंय. योगा म्हणजे स्पेसिफिकच योगा तुम्ही केला पाहिजे. देन यू आर गोइंग टू गेट द रिझल्ट. नो, इट इज नॉट लाईक दॅट. It's like that. That is the thing which I believe it. And normally, whoever comes in our class, in our studio, I do tell them that if you want to learn the specific type of yoga, it is not going to happen. It is going to happen with your body type, with your prakriti, with your age. It also depends upon the climate. Climatical conditions कसे आहेत. जसं as Dr. Vaishali ma'am she said it की असं पर्टिक्युलर डाएट सांगू नाही शकत की ह्याला हेच खाल्लं पाहिजे, त्याला तेच खाल्लं पाहिजे. इवन आय कॅनॉट टेल दॅट स्पेसिफिक योगाच केला पाहिजे. तोच योगा केल्यानंतर यू आर गोइंग टू गेट रिझल्ट. नो, इट कॅनॉट हॅपन लाईक दॅट. इट डिपेंड्स अपॉन युअर क्लायमेटिकल कंडिशन्स. त्याच्यावर डिपेंड आहे. आज क्लाउडी वेदर आहे.
Hmm.
आय हॅव टू टीच अकॉर्डिंग टू दॅट.
Yes.
त्यानुसार मला शिकवावं लागेल. तुम्ही तेव्हा तुमची ब्रीदिंग पॅटर्न कशी आहे. आय हॅव टू चेक युअर nostril. Which nostril is more prominent than the other? Your right nostril is prominent or your left nostril is prominent? It depends upon your prakriti. I have to do the slightly the nadi parikshan. I have to see
Hmm.
that vata जास्त चालू आहे का पित्त जास्त चालू आहे. I have to see that person's temperament. Temperament
Okay.
कसं आहे त्याचं. Mood swings कसे आहेत. It depends upon that. Yoga is all
Hmm.
about that. It's not about the stretching and this thing. That is the thing.
Yes, correct. I think I have one question common for both of you. In recent studies, we are observing that there are high cases of migraine or extreme headache on day-to-day basis. They are coming up. So I think I'll come to Bhakti ji first. If you can give us some tip, like it's as a first aid. I am suffering from a headache, severe headache or migraine. Let's say मी ऑफिसमध्ये आहे किंवा मी घरी कुठेतरी काहीतरी कामात आहे, तर मी काय केलं पाहिजे? व्हॉट शुड आय डू immediately to relieve myself of that pain?
Yeah. Yeah. Yeah, surely will tell you about that. But before that, I would like to tell you when you have a migraine, it's all depend upon your lifestyle. तुमच्या
Hmm.
लाईफस्टाईलवर डिपेंड आहे.
Hmm.
तुम्ही जर रात्री 12-1 वाजता झोपत असाल आणि पहाटे लवकर उठत असाल किंवा जेव्हा उठायचा टायमिंग असेल तेव्हा तुम्ही झोपताय, इट इज गोइंग
Hmm.
टू अफेक्ट युअर सिस्टम. तुमच्या
Yes.
ह्याच्यावर डिपेंड होऊन त्याच्यावर इफेक्ट होणार आहे कम्प्लिटली. तर तुम्हाला
Yes.
तुमची लाईफस्टाईल चेंज करावं लागेल. 8 hours sleep is 7 to 8 hours sleep is required for any human body. It is really
Hmm.
required for that.
Hmm.
So you
Hmm.
have to do that thing. And when you have a headache to your left side or your right side, कोणत्याही साईडला आहे तुम्हाला हेडेक, इट्स लाईक दॅट. विल टेल यू अ स्मॉल टेक्निक. इट्स लाईक दॅट.
Hmm.
आपल्या कान जो आहे राईट, दिस इज द इयर,
Hmm.
जिथे आपण
Yes.
चष्मा घालतो.
हो.
ओके, दॅट
हो.
थिंग. त्या पार्टला थोडासा हात लावून थोडंसं खाली जायचंय. थोडं खाली खाली गेल्यानंतर यू विल फाइंड अ डिप्रेसिव्ह पार्ट. एक थोडा
Hmm.
खड्ड्यासारखं फील होईल. तिथे थंबनी तुम्हाला प्रेस करायचंय. एकदम जोरात नाही, हलक्या हाताने स्लाइटली यू हॅव टू रोटेट इट क्लॉकवाईज अँड अँटी क्लॉकवाईज ऍटलीस्ट फॉर 30 seconds. प्रेस करताना तुमच्या राईट किंवा लेफ्ट साईडला जिथे तुम्हाला ज्या साईडला पेन होतंय तिथे तुम्हाला म्हणजे राईट साईडला पेन होतं तुम्हाला राईट साईडला पेन होईल. लेफ्टला तर लेफ्टला पेन होईल. तर वेन यू आर फिलिंग दॅट थिंग, जर राईट साईडला झालं तर राईट साईडचा हार्ट सोडून देन यू हॅव टू डू थिंग वॉट एव्हर साईड तिथे तुम्हाला प्रेस करायचंय. 30 seconds clockwise, anti-clockwise. Immediately your pain will go. This works over your
Okay,
migraine.
fantastic. I think hey, that will help lot of people, including myself. I sometimes whenever I feel severe headache and when I'm doing some work, it feels irritated. We can't really concentrate and it becomes difficult. So I'm sure our viewers will also practice this thing. Vaishali, madam, something
Yeah,
from you. Yes, yes, please, please, Bhakti ji, tell.
yeah. One more thing. The reason इथे का प्रेस केल्यानंतर असं कारण आपल्या बॉडीमधली जी वायू असतो किंवा अग्नी असतो तो इथे जाऊन साठतो. इथे जाऊन
Hmm.
फिक्स होऊन जातो completely
Hmm.
and that's the reason when it rises high it hampers your head. It
Hmm.
affects
Hmm.
because this is connected to here completely.
Hmm. Hmm.
That's the reason तुम्हाला तिथे प्रेस करायचं आहे. So you should know why you are doing it. I'm just telling you that's the
Yes.
reason you're following it. You should not follow anything blindly. You should know
Yes, absolutely.
why it works, how it works. That is the only thing.
Yes, correct, correct.
Yeah.
And
Next.
I am,
Done.
I tell my audiences here also that whenever you're seeing something online, unless and until you do not approach a professional, you shouldn't, treat yourself or diagnose yourself. आजकाल काय होतं, like nowadays it happens, people come to us saying I have ADHD, मला anxiety आहे, मला stress आहे. When we ask them how do you know this, so I self analyzed on myself on Google. So Google नुसार मला anxiety आहे, मला stress आहे. So I, yes, thank you Bhakti ji for telling us, you should definitely approach a professional. Coming to Vaishali ji, हे काही लाईफस्टाईल गोष्टी जी आहेत आजकाल, डायबिटीज
Hmm.
झालं, आता काही हिस्ट्री असे आम्ही पेशंट्स बघतोय की ज्यांच्या फॅमिलीत कोणामध्येच डायबिटीज नाहीये, और
Hmm.
नो केसेस ऑफ हार्ट अटॅक्स ऑल्सो, but still they are having it, and I'm sure it's because of lifestyle changes. So what you would suggest, and concluding your statement, how you should do self care?
Yes, definitely. Yes, sometimes there are cases that we don't have any family history or no genetic trace कि ये मेरे ancestor में है इसलिए मुझे हुआ. लेकिन
Mm-hmm.
we have to follow our own routine कि
Mm-hmm.
what type of work we are doing. Is there any rush or stressed job है? Because this is a rat race and we cannot be just left this world and go and live in the another world. We
Mm.
have to manage this race but very consciously.
Yes.
Okay, there is stress, there is a rush, and because टाइम नहीं है तो जैसे भी टाइम मिलता है हम खाते हैं. There are so much advertisement we can see, even western food, fast food is
Mm.
there. So there are preservatives in that food. शॉर्ट टर्म में जैसे बनाना है, कुकिंग है, पैक्ड फूड है, स्टोरेज के लिए उसमें बहुत सारे केमिकल, मोर सोडियम, प्रिजर्वेटिव रहते हैं विच आर नॉट गुड टू अवर हेल्थ. सो
Mm-hmm.
फूड है, डाइट है अपना, रश है, टाइम की वजह से हम एक्सरसाइज न करते हैं, और स्लीप भी ठीक नहीं होती है. रात के टाइम हम मोबाइल देखते हैं, बहुत सारा मोबाइल इंटरनेट का यूज रहता है. ऑल दिस फैक्टर्स are not healthy. So eventually they affect our physical health and mental health. अभी टाइम नहीं है तो हम लोगों से ज़्यादा बात नहीं करते, चलो व्हाट्सएप पे मिल लिए, व्हाट्सएप पे विश कर लिया. सो क्लोज फ्रेंड कुछ नहीं होता है कि शेयरिंग नहीं होती है. जो भी मेरा
Mm.
प्रॉब्लम है या मुझे कुछ चीज़ें खटकती अच्छी नहीं लगती, वी हैव टू शेयर. देयर मस्ट बी सम इन पर्सन क्लोज वन, क्लोज फ्रेंड, रिलेटिव होना चाहिए. शेयरिंग से भी जो अपना स्ट्रेस है, प्रेशर है, नेगेटिव इमोशंस है, वो रिलीज होने चाहिए. सो ऑल दिस फैक्टर्स रिलीज आवर स्ट्रेस एंड दिस. जो भी अभी के डिसीज है, ब्लड प्रेशर है, डायबिटीज है, वो ये चीज़ें एग्रीवेट करती है स्ट्रेस की वजह से. अपना फूड अच्छा नहीं है, स्लीप अच्छा नहीं है, हम एक्सरसाइज ही नहीं करते, मेरे पास टाइम ही नहीं है. वैसे देखा जाए तो टाइम किसी के पास नहीं रहेगा, बट वी हैव टू टेक फॉर टाइम फॉर आवर सेल्फ. क्योंकि अभी काम नहीं करेंगे तो बाद में तो बहुत सारा
Yes.
टाइम, और जस्ट चलो कहाँ एक्सरसाइज करना है, क्यों योगा करे, एक गोली खाने से मेरा काम हो जाता है, मेरे शुगर मैनेज हो जाती है. दिस अप्रोच शुड नॉट बी देयर. बिकॉज अगर फूड से, अच्छी हेल्थ से, एक्सरसाइज से हमारे बॉडी फंक्शंस मेंटेन होते हैं तो दैट्स गुड. बिकॉज एवरी केमिकल हैज देयर ओन इफेक्ट, गुड एज वेल एज बैड इफेक्ट. तो
Yes.
well balanced diet, good exercise, sound sleep is essential to maintain our overall health, physical health and mental health. दो फैमिली में आपके कोई भी डिसीज नहीं है, फिर भी आप हम जो खाते हैं, कैसा आहार लेते हैं, वो अपना जो भी ट्रेडिशनल फूड है वही अच्छा है। अभी का फास्ट फूड चलो वंस इन अ वाइल इट्स ओके कि हम कहीं गए खाया, वंस इन अ वाइल इट्स ओके, बट रूटीन में जो अपने है रेगुलर फ्रूट्स है, वेजिटेबल्स है, और जो भी है गेहूँ, चावल, बाजरी, मक्का, जो अपना एंसेस्ट्रल ट्रेडिशनल फूड है, सीजन के हिसाब से फूड खाना चाहिए। चल अभी रात को
डेफिनेटली।
मुझे बहुत सारा टाइम है, अभी मैं टीवी देख के खा सकता हूँ। मैं कितना खा रहा हूँ, क्या खा रहा हूँ, उस पे हम ध्यान ही नहीं देते हैं। वेट बढ़ रहा है मुझे पता चलता है, लेकिन मुझे हाँ कल एक्सरसाइज करते हैं, परसों करते हैं, चलो 1 जनवरी ऐसा नहीं होता। या इट्स डिफिकल्ट टू कंट्रोल आवर सेल्स, आवर इमोशंस। एक्सरसाइज करना पसंद है, बट वी हैव टू मोटिवेट आवर सेल्फ, मोटिवेट आवर फ्रेंड्स टू गुड हेल्थ, बैलेंस्ड हेल्थ, एक्सरसाइज, फूड, स्लीप, इन सारी चीज़ों से ही अच्छी हेल्थ बनती है। वो कोई ऐसे चलो शॉप में गए और अच्छी हेल्थ ली, ऐसे नहीं।
डेफिनेटली, डेफिनेटली, यस, यस।
वर्क ऑन इट,
यस।
बाय हार्ट वो
थैंक यू।
करना चाहिए।
हाँ, हाँ, डेफिनेटली, डेफिनेटली। और शायद से आई थिंक दिस इज द पर्पस mental health awareness program has been launched, and to share with the audience that both our panelists today are actually our partners into this initiative, and I appeal all of you to join, share this initiative with your friends, relatives, colleagues एट वर्क स्पेस। एंड मैडम ने जैसा कहा, दोनों ने जैसा कहा कि कोई एक स्पेस होना चाहिए जहां पे आप शेयर करते हो, यू आर शेयरिंग योर व्हाट यू वुड लाइक टू से, देयर समथिंग in you that's been troubling you, or it can be happy moment also. There should be someone to share, and that's why mental health awareness program is here for you, to provide a safe space, uh, professionals to listen to you. I think you have answered in a best possible way to all the questions that has been put by our audiences. So for that, I really thank both of you, and I express my gratitude for both of you coming down here, sharing your insight and enlightening every one of us. Once again, for our audiences, do share, support, and like our initiative, Mental Health Awareness Program 2023, and stay connected. Thank you so much. Namaste.
थैंक यू।
Thank you.